So a lot of people ask the question, what American TelePhysician is doing, because they see different ventures. So over the time period, American TelePhysicians now has transformed itself into a digital healthcare ecosystem, an incubator for digital healthcare ecosystem. We incubate different specialty-based or disease-based focused ventures, which on the back end has to be integrated. So I always give the example, think about when traditionally you take any healthcare system, they have an inpatient unit, then they have outpatient department, then you have a department of cardiology, neurology, the different specialty, because again, it all comes to a patient does need primary care, but they also need different specialists. The thing that moving forward I would envision is that when you're talking about this into a digital and virtual healthcare space, it has to be the same follow-up there. As we are moving, we're seeing a concept of home hospital program. The patient essentially can be, if they are, unless they're really sick there, they can still be managed at home there. But from that perspective, they also need specialists, right? So you're building online specialty programs. This is essentially what the vision is, how we can utilize, leverage technology, specialist physicians, and all those right partners, what we need for specialty care into one, integrated one platform, and essentially providing that care. And this led us to kind of launch, a couple of projects. So more notably, NeuroX, the brain health. Well, let's talk about NeuroX, our brain health ecosystem. So we started in the COVID traditionally as a platform which will give access to neurologists online, because that's how COVID accelerated telemedicine. And initially it was about just giving them access, because it's hard to find specialists, wait time is long and all things. So traditionally telemedicine has been, how can you connect with the physician or healthcare provider online? That's pretty traditional. But that's not just the end of the story, because I think it's just the beginning of the story. In fact, now where the whole technology has shaped, that's the journey of the virtual health telemedicine starts with the data integration. So one of the big problems in the US healthcare system is that unfortunately we have moved from paper mess to digital mess, right? So your patient's data is kind of in chunks and various, it's not integrated. There are a lot of efforts being going on. And I think this is what is the key. So we want patients to be empowered. They have access and control of their clinical data. Then utilize that data, use AI to build risk assessments. So take example, if I ask you, okay, what are your health conditions today? What sort of labs were previously done? And now you essentially utilize that information and use AI tools to tell you what's your stroke risk, what's your heart disease risk, what's your risk for kidney diseases, and what are your personalized care plans, what needs to be done next. So this is obviously, as a whole, those require a lot of kind of integrated tools, but story starts here. Now you have this, what to do next? Now then you bring physicians into place. So giving those patients now access to the right physicians. So you need obviously cardiac, you need cardiologists. For neurology, you need neurologists, right? Mental health psychiatrists. So improving access to them. You can certainly gold standards to see doctor in the office. Absolutely. What we have learned is the best optimal model is a hybrid care. So you need to see a doctor in person for more complex, or at least initially, but then a lot of them can be follow-up, right? So we essentially then utilize this technology to give them access. Now think from the physician perspective now. The physician now wants to, especially if you're a specialist, you want to order more labs, you want to get more study, you want to get other maybe potentially other referral to other physicians in order to provide a comprehensive care. Now it's important to have all those ancillary services part of that digital journey. So you now incorporate those, and when these patients get those results, blood work or radiology testing, everything there, it needs to come back to the physician, right? And then they need to do the care plans. Now you're talking about the care plans. What happens after care plan? So, this is what another problem happens, that patients, what about patients who are not engaged or they do lose, the follow-up there. This is where remote patient monitoring, the wearable devices, has so much to play, because now you can essentially monitor those patients who are at home with all their, the clinical data coming to the physician. I'm a hypertension specialist, blood pressure, so a lot of these patients who I see in the clinic, we give them this blood pressure device. They take the blood pressure readings at home. Readings come automatic in our system, so you have alerts set up. And if their blood pressure is, out of those ranges, it generates alerts to the nurse, and the nurse coordinates between the patient and the physician for this, their medication management. The result is immediate access, or at least prompt access. You reduce the ER visits, and more importantly, you also reduce their morbidity and chances of, having adverse effects there. Traditionally, it was like you really had to, you tell the patient, take the blood pressure at home, they write the reading. Sometimes they write the reading, sometimes they do not. Then they have to come to the doctor's office, bring all the paper, and then you tell them, what to do next. I have taken a lot of patients off the blood pressure medicine because as monitoring, we saw how the blood pressure was running based on actual data. So this is the power of the data.